is next.
There's a huge amount of scientific data available on the potential health and biological effects of radio frequency field.
The transition from a society connected by cords to a wireless one has been quick. Just 25 years after cell phones were introduced, over 20 million Canadians now use them, pumping cash into a $16 billion a year industry. But this week in Ottawa, complaints were raised that the government's exposure standards for radio frequencies may be set too low. Global National's Shirley Engel has a reality check on where science stands.
Device, this magic little gizmo is not quite as harmless as you might think.
Tens of thousands of studies later, naysayers still aren't convinced wireless technology isn't slowly making us sick.
Difficulty in concentration, depression, memory loss, visual disruption.
Jose Levesque had to quit his job installing wireless equipment because of the pain. He now wears a special scarf.
This is the cotton with copper to protect me to the microwave.
In a world where virtually everything is wireless, consider how many sources of electromagnetic energy you're exposed to 24 hours a day. Last year, Health Canada updated Safety Code 6. That's their set of guidelines for safe exposure levels from 1999, enforced by Industry Canada. Those levels are 50 times below any observed harmful effects. Still, a neuroscientist from Sweden told a parliamentary committee there's evidence even low frequencies lead to biological changes.
It's obvious that your safety code is completely out of date and obsolete.
But MPs are getting conflicting information. Much of the harmful evidence has been inconclusive, and Health Canada insists our standards are in line with the U.S. and Europe.
Until there's that evidence that there's a cause and effect relationship, we don't think that they're caused by the electromagnetic radiation.
What's a parent to do?
Some are taking matters into their own hands. Lakehead University banned wireless, and 4 Canadian communities have declared electromagnetic sensitivity months. Just last week, Europe launched the biggest ever global study, 250,000 mobile users. But it'll be years before those findings are known. In the meantime, one of Canada's leading experts on the issue says
it would be wise to be cautious and continue looking at those effects. But at this point in time, I don't think we need to be overly concerned.
But if you still are, you can always limit your exposure. Use hands-free or just call from a landline. Shirley Engel, Global News, Ottawa.